Thanks very much, Concordia, and probably maybe my last topical issue, and thanks to Concordia for allowing it, and the Minister for taking it. And Minister, I've said many times, I find it a bit unfair to you that you're wheeled out here on a Thursday evening to listen to all and sundry about different issues. But and look, I've covered this topic so many times in the last couple of months, and I have struggled to get answers, and you probably haven't brought them with you either. The last day with Pascal, I think I asked him 25 questions, and he poorly answered 2 of them, and left 23 of them unanswered. I never got any answers for them since. But I do find that the government's handling of the Children's Hospital to be one of the most disappointing things I've seen in my 8 years in here, probably only beaten by the tolerance of what went on in Nama all through that time. But when the PwC report was done and they told us that it wasn't a good idea to retender, they actually never even told us, gave us any evidence or backup as to why that was the case, and that was incredibly disappointing. The Taoiseach told me at one stage when I was querying him on it that a gross underestimate that should have been flagged earlier took place. A public benchmarking gives you an advanced estimation of what the works would cost, but I inquired as to who actually decided not to do a public benchmarking, but no one ever told me. I mean, I don't understand why people can't answer questions. The nature of the contract itself, I've asked so many questions about it. I got some written answers back, but there's still confusion about it. I realise at this stage that there was a form of bespoke used rather than the black and white construction works management framework, which is a disaster. For the life of me, I still don't understand why the government haven't abandoned it. But the stuff I heard yesterday at committee, and I've heard politicians and media talking about it, and it makes me pull my hair out. But they're talking about that because construction inflation may have exceeded 4%, that the contractor is allowed to charge so much extra here, right? But I mean, first of all, why was inflation removed from being a contractor's risk? Because there's no actual sense to that. And why was 4% used? Who made the decision to put the mark at 4, that if anything above that takes place, then the contractor was entitled to more money? I mean, if you had used the FIDIC, which was recommended and is best international practice, and you would have attracted European contractors and not just the couple of fish in the bowl in Ireland. But with FIDIC, they actually set the benchmark at 12 or 13 before the problems of construction inflation would kick in. For the life of me, can someone in government tell me who actually made the call that the benchmark, that the mark would be 4%, that anything above that? And Minister, look, we don't have a lot of time, but the talk yesterday about construction inflation is the big problem, this, that, and the other, that is rubbish. It's part of the problem. We're not talking about 1.7 billion here. We're talking, it won't stop at 2 billion, and you haven't a clue where it's going to stop because of the nature of the arrangement that you have made. The nature of the contract is so poor that you cannot know where the price will stop. How can that be a satisfactory arrangement for the government? That is beyond me, Minister. I don't understand how you can possibly stand over it.
Thanks, Cathaoirleach. Thank you. And on behalf of Minister Harris, I will be taking this topical issue. And I just want to begin by congratulating Deputy Wallace on his election as an MEP to European Union. I want to wish yourself really well. I'm sure we'll still hear your voice loud and clear from across the waters. So just to say that to you in starting. I want to remind the House of the significant progress that has been made on this project after false starts and failures to build this hospital over many years. Difficult issues such as planning, completing the enableability of the underground works and contracts negotiations have been dealt with, and this project is now in major construction phase. Considerable work has been undertaken on the project, with Phase B about the groundworks well underway at St James's site. Work on the paediatric outpatient and urgent care centre at Conley are completed, and the centre is on target for a phase opening at the end of July. Works at Tala OPD Urgent Care Centre are also underway with a targeted handover date of July 2020. The contract in place to build the hospital has allowed early phase of work to start, while the details on later phases was finalised and agreed, resulting in a savings in total delivery time. Another advantage of the contract approach is that it has brought to issues of cost to the fore much earlier than life of the project than in the case where traditionally procurement processes are deployed. The contractors are now required to take all risk quantities thereafter, and the recovery of additional costs is limited to clearly defined scope changes and the post-July 2019 inflation in excess of 4%. Given the cost of escalation of the project over the original commitment by the Government in 2017, 3 options were considered in December 2018 for completing Phase B. Carrying on with the current contractor, retaining in the hope of getting a lower quote, or breaking up the contractors into small parts and retendering. The realistic and least risky option available to the Government in order to avoid a long delay and potentially the non-delivery of the Children's Hospital was to carry on the current contractor for Phase B. Any changes now would definitely create delay, very little cost increase and significant contractual difficulties. All of these proposed, the other contractors would want to take on this project, which is not at all certain in the current construction environment. All deputies will be aware that the PwC report of the independent review into the escalation in the cost of the new Children's Hospital was considered by Government on Tuesday the 9th of April and published on the same day. The Government noted that the recommendation of the report and agreed that the Minister for Public Expenditure and Reform and the Minister for Health would revert to the Government to online an implementation plan for the recommendations contained in the report. Work in relation to this implementation plan is ongoing. Any consideration or re-tendering at this stage ignores the contractual position, subsequently work done to date, and run the risk of delaying, if not outright derailing, this much-needed facility. The focus now is on enhancing of the delivery and oversight arrangements to reduce the risks of further cost increase to the greatest extent possible. This is a vital and much-needed project that will have a transformation effect on the provision of paediatric care in Ireland. And I'll come back to Deputy Wallace on this question.
Thanks, Minister. But look, I mean, listen, to say that the realistic and least risky option available to the Government in order to avoid long delay and potentially the non-delivery of a children's hospital was to carry on regardless, I don't accept that. The notion that the hospital won't be built is totally untrue. So, of course it's going to be built by somebody. And if you improve the contract, you save a whole lot of money. That's a fact. And for the life of me, given that so many mistakes are made, and the Government have accepted that you've made a whole lot of mistakes, how come nobody has been held responsible? McCann Fitzgerald were the legal team. Why are they not being held to account? Have they no insurance? I don't understand. I mean, there's no sense to it. I mean, if you're not going to hold consultants to account when they fuck up, they should stop hiring them. That doesn't make any sense. The idea of hiring consultants is so that they'll take responsibility for their decisions. We're hiring consultants, paying them crazy money, and then we're not asking them to be accountable for what they did. We're not calling in their professional indemnity. So why do you hire them at all? And you're saying you're going to learn from these mistakes. What? Do you know what? I don't think you will. If you can't hold public consultants or private consultants to account, I suggest you stop hiring them. And I suggest that you hire people to work in your departments of quality, with knowledge and know-how, to be able to deal with these problems. The people that oversaw what went on with the Children's Hospital, what oversaw the contract, the way the board worked, is nonsense, and ye are putting up with it, and you are losing this country millions, hundreds of millions. And if you retender it, you can change this. But you don't want to retender it because it's seen as a negative. Oh, it won't look good, and the project might be stalled while you're running the next election. This is nonsense. This is not the way to run a country. Seriously, though. I mean, look, I can't get over that you have managed this so poorly. There are so many questions not being answered. I can't count. I say I've asked 50 questions in here that weren't answered. And there's so much confusion about everything. And you're hiding behind consultants now who gave bad advice and a board that is not accountable. And how laughable is it that a guy that was involved with the legal board, with McCann Fitzgerald, and was on the hospital board, is now moving over to the Land Development Agency? How many mistakes do you have to make in these bodies before they stop offering you work in other bodies? The Land Development Agency, I tell you what, I predict now that is going to be seriously another part of the problem, another quango that will not deliver for the Irish people. The same as this hospital board hasn't, that the consultants hired and paid crazy money for the Children's Hospital haven't been held to account and haven't come up with the goodies. Minister, when are things going to change? This is absolute rubbish.
Good evening.
Thanks again to Deputy Wallace, and I'm really sorry, Deputy Wallace, that I can't answer some of the detailed questions that you've asked. However, I will relay them back to the Minister. However, I do fundamentally disagree with you about the way the project had been run from the beginning. It's not just a building that we're talking about here. It's having a facility for all the children of Ireland, and it is as well having a facility in a community that I know on a personal basis has changed the lives of people who are even working in the construction industry now. So there's lots of other tentacles besides just building the new National Children's Hospital. It's about a community being revitalised as well. So I have no other opinion on that. The independent review of the cost of new National Children's Hospital undertaken by the PwC pointed out that the project of complexity of the hospital can never be fully de-risked. The report states that the number of risks areas remain have the potential to place further cost pressures on the budget, some of which are outside the control of the National Paediatric Hospital Development Board. One risk related to construction inflation, the contract has further likely costs arising from the impact of excessive inflation post-July 2019, i.e. in the excess of 4%, as provided in the contract and measured using the average of this published tender price index. In primary focus on the National Paediatric Hospital Development Board to manage risk with a view to preventing further cost escalations. In conclusion, the establishment of the new Children's Hospital provides a unique opportunity to introduce a new model of care for all paediatric services to help tackling current and further challenges in child health and the delivering of a huge advantages that are possible in children's health care. And can I just finish by saying, Corley, that, you know, as someone who lives quite close to the new National Children's Hospital, the impact that the hospital will not only have on the lives of many children from across the country, but on the lives of the community in an area that has, in many years, been left behind. So, furthermore, what I want to say to Deputy Wallace is, I don't know any project that has happened in this government's time, or in the last government's time, or the one before, that didn't exceed some of the costs. The government has given a commitment, and so has Minister Harris, that every precaution will be taken to reduce the risk of inflation. And at the end of the day, Deputy Wallace, what we will have when this hospital is completed is a hospital of excellence and probably one of the best in Europe, if not in the world. And I welcome that on behalf of this government, but I welcome it on behalf of the many children. And as somebody as a mother and as a grandparent who has spent many days in and out of Crumlin Hospital, I have to tell you that the opportunity that awaits the children and the staff of this new hospital into the future will overcome any overspend that might be spent into the future on the hospital. And I welcome the fact that Deputy Wallace has come here this afternoon, maybe for the first time in this chamber, but I do again wish him every success as a member of the European Parliament, because in the European Parliament there's many things that Deputy Wallace and our other MPs from all across political parties and none can advance for our country in Ireland into the future in health as well. So I want to wish him all the best.
Thank you, Minister.